How's it going? It's Dr. Greg Marion here at One Spine Chiropractic. Today we're going to be discussing the One Spine process on what we do to get the relief we need and the great results we get here in our clinic. So with a condition called sciatica, that's a big fancy word saying that we have pressure on the nerve that stems from the 5 nerve roots of that lower back, bunches together, makes it the big sciatic nerve. Did we know the sciatic nerve is the longest nerve in the body? It is. And what we want to do is, at our clinic, we want to start off with a thorough consultation to figure out where that problem's coming from, but more importantly, how long that problem may have been there. So what we do is we ask a host of questions to figure out what we need to get the treatment options we need, but more importantly, pinpoint the findings of causing the issues. So what we're going to do today as well is do an examination. This examination consists of a chiropractic examination, neurological examination, orthopedic examination. So we'll be telling what tests we do, what positive symptoms we're having, tells us where that problem's coming from. It could be coming from the bones misaligned, being subluxated, putting pressure on the nerve. So what we do chiropractically is do the chiropractic adjustment. It might be coming from tight muscles that house that sciatic nerve in there. So what we want to do is do the orthopedic test to figure out if it's coming from there, or even possibly a bulging or herniated disc as we see here. So what we want to do is evaluate these discs, orthopedic test, to figure out if it's coming from the disc, the nerve, or the muscle. And what's the great thing is as chiropractors, we treat all those conditions and get great results with them. So what we want to do after that, if those tests are positive, we might also take some x-rays. So during the x-ray process, we're evaluating the spine from front to back to see the misalignments of the spine, maybe misalignments of the pelvis, but also we do a lateral view of the x-ray, because this lateral view tells us how these discs are doing, and if these discs are compressed or herniated, maybe even degenerated from old age, that also puts pressure into the nerve root, causing some of the sciatic pain. So that's another option we have, is doing the x-ray here in-house. We get results in, quick. So another thing we're going to do is, after your consultation, examination, and x-rays, is we'll do some treatment options. We'll start with the chiropractic adjustment like I mentioned before, because what that adjustment is, it consists of the bone being misaligned, and what we do is we put that bone back in place so the body can function, the joints can move the way they need to. Getting the bones lined up properly takes pressure off the sciatic nerve roots that make up the big nerve, but more importantly, we evaluate the pelvis as well and see if it might be coming from that area as well. So a lot of times what we do is we see a pelvis that's misaligned and stuck. That puts pressure on the nerve root that's going down the leg. So we might be having that sciatic symptom that's causing radiating pain into the buttock, down the leg, into the calf, and maybe into the foot. A lot of times patients have sharp, severe pain, numbness, tingling, or maybe like a deep ache. So that is more sciatica that we need to get treated and get corrected. Okay, so after the adjustment process, if it's coming from a muscle issue, we have several options for that. So one of the treatment options we offer is electric stim and heat. So what we do is we find the muscles that are taut in that lower back, and we put some electrode pads back there that the muscles get relaxed. It's like an electrical massage. So what it does, it lets the muscles relax in case the muscle is getting entrapped there, putting pressure on the nerve. We'll get the relief that way. Another option we have for sciatica due to muscular pain is manual therapy. What we do is go in there and strip the muscles and break up the trigger points. And besides the manual therapy, we have a hypervolt machine we use here. We also have a shockwave therapy machine that gets great results and break up some of the chronic scar tissue that we might be having from some imbalances or overuse. Okay, so there's some treatment options we have there for tight muscles. Another option we have is a sciatic issue that's coming from a bulging or herniated disc. As we mentioned before, we're going to show you that video later on, but when you have a bulging or herniated disc, that disc, instead of being nice and happy and having free space for the nerve to flow through, gets impinged because it bulges and herniates out to that area. So what we see is a lot of sharp, severe pain, radiating pain down the lower back into that buttock. So what we do is we offer spinal decompression that separates the vertebra back here, and as it's separating the vertebra, there's a negative pressure, and that disc sucks back in. As that disc is sucking back in, the nerve gets free, but more importantly, we get to the root cause, and there's less pain in that area, and the nerve is actually able to heal up with time. So that's an option that we have that's a lot better than surgery, because surgery is not a great option, because what they like to do is they take the disc out, put a spacer there, put a plate, put some screws, and do a fusion back there. Success rate of those surgeries is not very good, typically 20 to 40% success rate, but more importantly, you're out It's lots of money, but more importantly as well, a lot out of time. 3 to 6 months healing process for that. So what we want to do is do something less invasive like chiropractic care and spinal decompression to get the results we need, okay? So if you're thinking you have any symptoms from sciatica that be coming from a bulging disc, call our office. Another option we have is deep tissue laser therapy. You mentioned the inflammation of a disc or nerve root. So what we do is we get the laser specifically on the area where we're having issues with. Say we have that herniated or bulging disc putting pressure on that nerve root. What we'll do is we'll get that laser specifically on that spot to get rid of some inflammation, let the body heal itself up. So it decreases the healing time, but more importantly, decreases inflammation as well to get you better faster. And it's very less invasive, but more importantly, the patient doesn't feel a thing and it works great. But if you have any questions, give our office a call. Like I said, we're here to help you and get you started on the right path for relief. Thank you.